How to use a blood sugar meter. A blood sugar meter measures the amount of sugar in a drop of blood. It can be inconvenient and the strips cost money, but checking your blood sugar is the only way to learn how different foods or physical activity affect you. Here's how to use a meter. First, wash your hands if they may have been in contact with food. That can affect the accuracy of your reading. Put the lancet into your device, then twist off the cap. If you are the only person using your lancet device, it is common to reuse the same lancet and change it when it gets dull. Insert a new test strip into the meter. Then close the cap. Exposing the strips to air can make them less accurate. Don't use them past their expiration date. To make the jab as painless as possible, find a lancing device that has an adjustable tip. Start with the second lowest setting. Pricking the sides of your fingers is less painful as the fingertips are very sensitive. Try alternating fingers each time you test. Now, trigger the device. Hold it firmly against the side of your finger and don't pull away when you push the button. Then gently squeeze out a little blood. Hold the test strip to the drop of blood until it has absorbed enough blood to begin the test. When the meter shows your blood sugar level, the test is done. 2 hours after you begin to eat, your blood sugar level should be less than 180. Sometimes it's hard to get a drop of blood. It may help to hold your arms down, shake your hands, or warm them. Then try rubbing from the hand down to the finger. You can also adjust your lancing device to a deeper setting. Remember, a blood sugar meter is key to learning how food and activity affect your blood sugar. It can be easy, quick, and painless.